If you're turning 65 and are going to be eligible for Medicare soon, you're going to want to watch this. A lot of people are afraid they're going to mess up when they're supposed to sign up, and they're worried they're going to end up with penalties. So what I'm going to do in this video is, instead of doing like the typical 1 minute, 2 minute video, this video could be as long as 10 minutes. TikTok's allowing me to do that. So if you don't have time to watch it now, put it into your favorites, save it, and it's definitely something you're going to want to watch. So I want to start by clarifying that this is for people who are not yet enrolled in Medicare. And there's 1 of 3 time periods that you'll be enrolling. It could be your initial enrollment period, a special enrollment period, or a general enrollment period. So I will break it down. And the first thing I want you to understand is if you're taking your Social Security prior, like 6 months prior to your 65th birth month, you're going to be automatically enrolled into Medicare. You don't have to take steps unless you've decided that you don't want to take Medicare. Then you'll have to reject it when you receive the card in the mail. Now, I'm going to assume for the purpose of this video that you are somebody that has to take steps to sign up for Medicare. And we're going to break it down into the 3 different time periods. So the first one I mentioned is your initial enrollment period, and it's the first time that you have been eligible for Medicare. So the question is, are you going to be enrolling during that time? Now, most people do need to enroll during their initial enrollment period unless they have work coverage, and I will address that. That comes under the special enrollment period. So here's your first opportunity to enroll in Medicare as you approach 65. Your initial enrollment period is a 7-month window. Your birth month is right in the middle. So you got the 3 months before your birth month and the 3 months after and your birth month to get this enrollment done, to do it timely and not have any sort of penalties. Now, if you're born July 14th, for example, the first 3 months leading up to your birth month, if you sign up anytime during those 3 months, you're going to have a July 1st start date. If you wait until July to sign up, you're going to have an August 1st start date. And then it goes on. So if you wait till August, you're going to have September, and etc. And during your initial enrollment period, these rules apply. So if you apply in July, you can't be like, hey, I want to wait till January. They're going to make you start August 1st. If you do any of those 3 months before your July birthday or birth month, you also are going to have that July 1st start date. So these rules are very exact in how they work. So how do you do this sign up? Okay, we're talking about Medicare here, but what often confuses people is that you're going to be doing this through the Social Security Administration. So think of the Social Security Administration as the gatekeeper to Medicare. They're the ones that determine if you've earned it, how much you're going to have to pay. They're in charge of enrollment. Once you're in Medicare, it's the Centers for Medicare and Medicaid Services that are in charge of your care. Now, up here are the 3 different ways that you could be signing up. First of all, you're going to start by creating a My Social Security account. That way you're verified, and that way you also have access to your Social Security statements. But you can do it by online. You could do it by calling in and making an appointment, and you also could try to make an in-person appointment to sign up for Medicare. But what if you're one of these people that you're still working at 65, which is a lot more common these days? People are living longer, they're working longer, and you have insurance through your company, and you decide, I don't want Medicare. Do you have to take it? Will you be penalized for not taking it? And the answer is you will not be penalized for not taking Medicare as long as you timely sign up for Medicare during your special enrollment period when you are no longer working and you're ready to roll into the next stage. So with the special enrollment period, sometimes people work for companies 20 or more employees and for companies, with 19 or less. In both scenarios, you will have a special enrollment period, no penalty. However, in the scenario where it's 20 or more employees, maybe you reject Medicare, maybe you just sign up for Part A, but if it's 19 or less employees, you're going to want to take Medicare. Otherwise, you only have a secondary payer. That's a whole nother video, but just know you need to take it in that 19 or less so that you have full insurance. So let's talk about that special enrollment period. This rule is in effect because it recognizes that people do work past 65 and maybe they don't need or want Medicare at that time. So the way a special enrollment period works is you have 8 months from your current work, whenever work ended, to get yourself enrolled into Medicare. A lot of people already take Medicare Part A even though they're working, unless they're in an HSA, because it's if they've earned a premium free, they figure why not just take it because it doesn't cost them anything. So it's usually B during the special enrollment period that you need to sign up. And you do have, like I said, that 8-month window. It comes from when your current work ended, or even while you're still in it if you're preparing to get to file. And what you're going to do is you're going to need 2 forms. You're going to need CMS 40-B, that's the Part B application, and the CMS 7564 form. And that's actually something that your employer has to fill out to show that you have had this continuous coverage and that you are entitled to a special enrollment period. And if you have a spouse also on your plan, you're both going to need that form. 2 forms are going to have to be filled out by the employer. So the important thing to know here is that they recognize some people are not taking Medicare, and this creates a circumstance where you can avoid penalties and get into Medicare based on your own special timing. The last period of time I want to talk about is something called the general enrollment period. And that's something you want to avoid because that is where you may end up getting penalties for not taking it timely during your IEP or your SEP. So what happens is, let's say you messed up. Someone wrote me recently, they said that, it's been a couple of years and they just never took it. Well, their first opportunity then to sign up is going to be January 1st of each year through March 31st. And the month that you sign up, you're going to start Medicare the first of the next month. But just know, with Medicare Part B, for every 12 months you didn't take it where you could have taken it, you're going to have a penalty of 10%, and it can be stacked and it stays with you forever. And for Part D, it's for every month. And there's 1% penalty based on a math calculation they do based on the national average premium. So during that time period, if you're somebody that did not take Medicare timely, don't miss that window again. That's your time, January 1st to March 31st, to get it done. So here's an example just to understand. So I had a couple call me recently. The wife's turning 65 in December. The husband is 67. He's going to be retiring. So they're coming in under 2 different ways. She's going to do her initial enrollment period. He's coming in under the special enrollment period. Even though she was on his insurance, her timing comes during her birth month, which is in December, and that's when she is going to have that 7-month window that we already discussed. Through the Social Security Administration, you are just signing up for A and B. So that's just the beginning of your work. The next thing you have to figure out is, are you going to stick with original Medicare with the Centers for Medicare and Medicaid Services, or are you going to go to a Medicare Advantage plan, Medicare Part C? Now just know, even though if you choose C, you still are signing up for A and B, and you're going to pay that Part B monthly premium. You don't avoid that by going into C. Now, once you get approved for A and B, like you have your start date, that's where oftentimes people work with an agent, or maybe they find someone through SHIP, or maybe they call Medicare. But the bottom line is that if you're going to go original Medicare, you want to consider a Medicare supplement plan and a Medicare Part D plan. And those are both applications that get submitted through whoever you work with, whoever helps you, to the carrier. Same thing with Medicare Part C. So none of those signups are through the Social Security Administration. As I mentioned, they're the initial gatekeeper, and then those are the decisions that you have to do that follow. I know this is a lot to take in, and if you ever want to reach out to me, you can use this link right here. You can set up a consultation with me. Happy to go through it with you. Sometimes people who are going to stay working still connect with me so that they understand that they've made the decision that's technically right with the way the rules are written. And then we connect again years later. So I'm happy to talk to people even under those circumstances. So hopefully this helped.